Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors. I want to thank you guys for being here with us. Remember to share, and share. We are here. I see some of our Instagram people are popping on already. So I want to say thank you so very much for popping in. So we are here. Remember to share on all of your social media platforms because it's Monday night and it's time for Couch Conversations with the Doctors. April is National Child Abuse Awareness Month, and it is also Minority Health Month. We're going to have some great guests going on this month. We're actually going to have a guest coming on shortly before the end of the month. We're going to talk about allergies and allergens because we'll be entering that season. So we'll have a guest doctor who will be on along with our esteemed panel of doctors that we have here. Hey, Sister Bonnie, I see that you're here and you're saying good evening with us. So we're going to go around the panel as always, and we're going to do our introduction starting with Dr. 100, Dr. 100, who keeps it real on these streets out here. That's our very own Dr. Maya Green. Dr. Green.
Good evening. Always glad to be here. Always glad to be keeping it 100, to learn from the community, explore with the community, and find out ways we can heal our tribe together. Thank you for having me, Congressman. Thank you for having me, Nikki.
All right. Then the man who says that I threaten him to be here every Monday, but he seems to always be on time. That's our very own Dr. James Miller. Dr. Miller.
Well, just want to say good evening, Nikki, and to Congressman Davis. We thank y'all for this platform. And I'm a retired intern. So retired in 2019. I've never lost my interest, which has always been my primary focus, to heal our community. So I don't practice clinical medicine, but I still work to heal the community. So we're here this evening to see what we can contribute that may be helpful and healing for some portion of our community.
Outstanding, and thank you so much to my colleague who leaves us and goes and have fun in the sun, but he still tends to make sure he gets around. That's our very own Dr. Douglas Graham. Dr. Graham.
Thank you, Nick. I'm kind of like Dr. Miller. I retired in 2019. Then I left for Washington, D.C. to spend 2 years in the congressman's office. And let me tell you, it is a really, really productive office, working hard to meet the needs of his constituents. It's an honor and privilege to be here. I'm going to try and answer your questions if I can.
Outstanding, and thank you so very much to the urologist of the stars, but he hates accolades. That's our very own Dr. Terry Mason. Dr. Mason.
Good evening, Nikki, and thank you and the Congressman for providing this outlet to give back to the community. And I look forward to every week that we have this show to just be able to field questions that people have or comments or whatever. So it's a great opportunity, and as the song in the church would say, I'm just glad to be in the service one more time.
All right, outstanding. To the art connoisseur, the man who has the greatest collection there is, that's our very own Joseph Harrington. Joe.
Well, thank you, Nikki, and thank Congressman Davis. I'm going to thank you and Congressman Davis for providing this platform like my colleagues. It's always great to be here. I have old friends here, and I've made some really new friends, and it's something that I really treasure is to be here every Monday. My background is primarily in public health and healthcare. I had the honor to work with Dr. Terry Mason when he was Commissioner of Health, City of Chicago. Worked at 3 hospitals. I retired in 2017 from the Illinois Department of Public Health, where I served as the regional health officer for Cook County and administrative law judge. And I know enough to be dangerous because I'm not a doctor.
Outstanding, outstanding. To the man who makes this possible for us each and every Monday night, to the one who teaches us that true wealth is health, our very own Congressman of the Illinois 7th Congressional District, Congressman Danny K. Davis. Congressman Davis?
Well, let me thank all of us for another evening of discussion. My last telephone call dealing with the client or constituent a few minutes ago, there was a family at the Madden Mental Health Center, and the doctor had given the patient authority to leave, to be discharged, and indicated that there wasn't anything else they needed to do today. And the family had been there, they said, for 5 hours, waiting to take her home. But the people there wouldn't let her leave. That is, the security people wouldn't let her leave. The administrators wouldn't let her leave. And I said, well, the best I can do is call around and see if I can get somebody. And I did, 2, 3 apartments. And the last I heard a few minutes ago, she was still unable to leave. And the family didn't know anything else to do. And I didn't either, other than sympathize with them. And I mention that only to mention that there are still many gaps in our healthcare delivery, even though we have made progress. And I don't know when we'll be able to close all of the gaps that exist, because in reality, we're talking about the same things we were talking about 50 years ago. We're talking about the same things we were talking about before that. And yet, I guess I got news today that 3 or 4 friends of mine are kind of on their last legs, meaning that they are not expected to live much longer. They all have had access to the quality health care, and yet they're on their last legs. And I guess it does cause non believers to wonder. And yet we just experienced the resurrection and Resurrection Sunday. And we all know the story of Easter, or the truth of Easter, and how Easter has come about. And there's still things to wonder. I heard in the sermon that Thomas, the doubter, said he couldn't believe all of this was going on until he saw the nail prints, and he saw where the atrocities had occurred to Jesus the Christ. And he still wasn't sure that he believed as things were. I guess my thought is, what will it really take to get us to where we think we ought to be in relationship to health care, health service, health status in our country? What is it that we're looking for? What do we think becomes appropriate? And yet there are some people who manage, to live a long time, long time, and others who don't. So what, I guess a question would be, what are we looking for in terms of health status in the United States of America? And I want to thank all of you for your engagement, for the knowledge that you bring to us, and whatever it is that we're looking for, Do you think we can find it? It's one thing if you don't know what you're looking for. And it's another thing that if you found it and don't know if that's what you've been looking for, what do we do? How do we keep moving? We spend billions of dollars on health research. Some individuals involved make a lot of money. Some people who do the same kind of work and may do more of it don't make the same kind of money that others doing the same work, same kind of work do. So, what becomes, I guess, our health policy as a nation and as people campaign for president and decide who's going to be president, who has a great deal of influence on what we become and what we be and what we do and what we don't do. Um, Let me just throw that out and ask who will take a grab at it and see what we're seeking. And thank you all so much. I've got some ideas, but I'd like to hear yours.
So I'm going to come forward with two ideas. And one is I think we have to change how we select medical students. Because I'm not somebody who believes that low value care is incurable. I think it is. But you have to find those individuals who are committed to always learning and improving the quality. Because once you get in, you don't have the same monitoring system. And it's really the same thing with cultural competencies. If you don't teach them and train them and test them, they're not going to develop them. So I think you got to look first to medical education. But the biggest thing that we need is stakeholder alignment. We're in a world now where one group of stakeholders is paid to squeeze as much of the profit out of the system as they can, while the other system is kind of being compensated for maybe delivering care or maybe not delivering care, add to the profits of the other side. Now, the problem with that is that the annual profit and loss system, according to the academics I've talked about, is the wrong system for healthcare. So if you spend a little this year, you're going to spend a lot next year. So I think we have to come to the understanding that if you want a healthy economy, you have to have a healthy workforce. And to have a healthy workforce, you have to change how you distribute the resources so that there's going to be something for everybody this year, next year, the year after. If you kick the can down the road, eventually it comes due. And we saw what happened with COVID. When everybody's sick, we can't work, the economy's in big, big trouble. So I think we have to kind of, as I said, we have to have alignment of the incentives here. So you can't have somebody paid to withhold care and somebody else paid to deliver care and deliver care of quality with limited resources. That's just not possible. The other thing I'm going to talk about is we have the wrong incentives, where if you watch television, we're incentivized to consume all the wrong things for all the wrong reasons. We're talking about highly processed foods. We're talking about high calorie foods. We're talking about high sugar and high salt foods. So it's like trying to take a trip and a journey in a boat where you don't have the drain plug in. You're only going to get so far before that boat's going to sink. You can't incentivize people to have the wrong diet for 40 years and then at the end of the road expect people to take care of them economically. That's never going to work.
I would agree with you on that, Doug, and I would add to this. I'd add this to it. And I think in your opening remarks, you alluded to it. But the value proposition in America is what I heard you say is that the value proposition is misaligned. The value proposition in and what we call medical care and things of that nature are really aligned around managing care, managing disease, but not really using the resources to see what we could do to number one, prevent the disease, because many of them are, and as well as using other things other than some of the things that we've been accustomed to treating these diseases. And of course, you got to layer into that, and I'll stop after this. You have to lay into this the opportunity of housing and being able to make certain that people can live and make a decent wage to take care of the things of necessity. So I would stop there, but there's a lot more.
Yeah, I'm going to jump in and say several things. First, I'm going to start with something that Judge Eugene Pincham used to always say: "You can't be what you can't see." And you can't know what you've never experienced. So in some respects, we talk about equity and we talk about these disparities, these gaps in health. So we're talking about populations that have been historically marginalized. So I don't know if many people could answer that question, because there's been no real equity in this country pretty much since this country was established. There's always been people that were poor. There are always people that have been discriminated against based upon race and ethnicity. That is the history of this country. So that's something that goes without saying. There's also the fact, as Dr. Mason points out, and he said this, and I know some of our colleagues have said this: we don't have a healthcare system. We have a system that's focused on disease detection and management. And that's where the money is. You detect disease, that's what healthcare does. Then they manage the disease. The money that we're talking about comes from managing disease, not necessarily detecting it, and definitely not from preventing the disease before it happens. So the incentives are wrong. And I'm not going to get into universal health care, but I can point out that the Affordable Care Act has changed that dynamic specifically. And it's interesting because we no longer refer to it as Obamacare. It is publicized and people know it now as the Affordable Care Act. And it implies that what this initiative was to do is to make health care affordable in the United States. But even though that's passed, it's still not available to everyone. And still, some people have not taken advantage of it. The last thing that I want to say is there's more access. We have more access to healthcare than we've ever had in this country, really because of the Affordable Care Act. More people actually have access. The other side of that is utilization, and people need to use healthcare. So I'm going to put the burden on people and patients more specifically. No disease, and this is what I've heard over and over again from my colleagues: no disease in its earliest, most treatable form presents with a symptom. There are no symptoms early on. That's why they call things like hypertension the silent killer. That's why most people don't understand the reason we've had this uptick in dialysis centers is because we have more and more people both with hypertension and diabetes, and those are the two leading causes of kidney disease. And that's why we have all these dialysis centers. And like Doug said, there's people have lost their sense of what food really is. And so they eat a lot of things that are not good for them, and really cause them over time to become sick. So it's a complicated and nuanced problem. I don't think there's one solution, but it's something that we really need to talk about and try to help people demystify and understand.
Well, I'll jump in. I'll add a couple of things. Joe mentioned that that it's about where the money goes, and my question is, whose money are we talking about? Because ultimately we're talking about the people's money, and a lot of these systems are either subsidized or paid for by the people's money. And it's like anything. When you buy a car, you can get in the car and you can drive it, never get it evaluated, never get the things that takes maintenance done, and the likelihood is that at some point in time you're going to run into a situation where you're going to have to pay more money than it would have been it cost you if you'd just done the regular maintenance, changing the oil, doing those things. Well, so the same thing here. I think our emphasis is as has been said, has to switch from detection and management to prevention. Because if we don't prevent some problems, then we're going to always be in a situation of having to pay more later. Pay me now, cost less. Pay me later when that disease that was there for some time has become more advanced. It's going to be costly, and also it's going to become less, give us less an opportunity to prolong life and to give quality of for that individual to live a quality life. So I think that we have to begin to focus more on preventing diseases. An ounce of prevention, like they say, is worth a pound of cure. And when I really sort of look at that in terms of the numbers, it says that it's better to invest a little something now than to pay a large amount later on when the problem is worse. He mentioned about hypertension. It's a disease that has no symptoms, and if you're waiting for symptoms, by the time that you get symptoms, you got symptoms of some end organ damage, which means that a lot of damage has occurred, and now it's going to cost you a lot more than it would have cost you by managing that problem before before the end organ damage began to occur. So we got to begin to focus more on prevention and educating the public in terms of what we can do for ourselves. There are a lot of things that and I think that this is what Doug was alluding to, is that there's their advertisement that sort of lure us into doing and to buying and to utilizing things that are bad for us, whether it be food, whether it be alcohol, all those kinds of things that's going to hurt us. But somebody makes money out of getting us to utilize those things, and if we fall into that okey doke, later on we're going to pay for it, and that is a big price. And so we got to begin to look at those kinds of things. I remember back when cigarettes did not have the warning label on it, and it now has a warning label. So I think what I'm saying is that maybe we need to start to putting warning labels on things that's going to hurt you, so that you at least be aware of that and maybe think about it before we utilize it, whether it be a certain food, whether it be other kinds of things that are dangerous and harmful to our health, before we get into a situation where now we have a problem that we can't do anything about, we can't reverse, we can't change, and now it's just a matter of just trying to hold it down.
James, Dr. Miller, what you just said is so very true. And it goes back to the thing is that, and the thing that Joe started out with, there is no value proposition for health. There isn't one.
Yeah.
There is no value proposition for health. The value proposition in our system of medical care is, again, and I'll say it again, is on managing disease. There's no part of the system that has been already clearly elaborated on by my colleagues that focuses and finances those things that would keep and make people healthy. And the thing is, because the thing is that most people, we're not using our televisions to help do that. We're not using our radio ads to do that. We're not using any of those things to do that. And then we created, as somebody said earlier, this whole idea of this so-called symptom issue. So that if I feel okay, I must be okay, which is the worst thing you could think. Because most diseases, as already stated, produce absolutely no sign or symptom in the earliest, most reversible part of that disease process. The last thing I'll say is that a lot of our diseases, and I'm going to put two on the table. One is so-called obesity. Obesity, what is that? That's a real situation, but we've got to also lay the blame at our food manufacturers and the kinds of things that they have done to help engineer the taste buds of America to support the fast industries and other things, so that we have a taste that is engineered that likes things that are crunchy, that slightly oily and salty. Those are the things that we like, not to mention the other things that are sweet. Mm-hmm. So there's a lot, because it just, there's a book by Dr. Moynihan called Selling Sickness, who said, I wanted everybody, he's a chairman, I think, of Merck, but he said, I want everybody taking a pill. And so, because that's how that's how they make their money. So the thing is, and then to blame the people as to why they're sick, that's not fair. That's not fair. And there's other things that we didn't talk about, like socioeconomic factors, like where people work, live, and play, have a also impact on how long and how well they live.
Well,
Please.
There's
Cindy
a program on,
oh, go ahead. No, go ahead. Go ahead,
and I'll
Bill.
be quick. There's a program I really find disturbing on the History Channel.
Mhm.
Food that built America. And I didn't know cookies were food. I didn't know tacos were food. I didn't know pizza was food. I don't know what they contributed to building America, but when, and that's not even a commercial. I mean, that's a program that's on every week. And every time I watch it, I'm trying to understand, well, where is the food that you're talking about that built America? You're talking about these giants in terms of mass producing certain foods that people now consume and are marketed at such a rate that people have really lost their idea of what food is and why food is essential to health. I remember this is a short story. When Dr. Mason was Commissioner of Health, one of the things that he was doing at the same time, he was taking people on tours of grocery stores. And they went to this grocery store. I can't remember. It was on 47th, I think 47th and Ashland. And they were in the produce department. And a woman was there with a young child. And her child picked up a tomato and took it to her mother and asked her mother what it was. And I'll never forget the answer. Her mother told the child, "That's what you put on your hamburger." That's where we are today. She didn't
Well,
call it a tomato.
Outstanding. Outstanding. Well, Linda Johnson is here and she says, good evening to everyone. Dorothy Murphy is here and she says, congratulations, Congressman, on your election. And thank you so much for your tremendous service to our beautiful city. Thanks to you and all the prestigious and learned panel for their valuable platform for these past few years. Connie Taylor is here and she says, good evening to everyone. Nellie Purnell King is here and she also says, good evening. And we have an Instagram comment that says, is this what we call sick care or health care?
Well, it's ill health care. You get the care when you're ill. You don't get the care when you're well. And I just want to tie into what Dr. Mason and Joseph Harrington said. We've got this concept that healthcare, like it is on television. You go to the doctor, he orders a blood test, and then you get some pills. And I'm a real true believer in the social determinants of health. So if I give you a prescription, but you can't get to the pharmacy, or the pharmacy is closed, or you can't eat good food, or you live in a town where there's lots of stuff in the air from the factories, you have no chance of getting well. You'll continually be sick. So health care is more than seeing the doctor and getting tests and a prescription. It probably has to do with all the things that influence your health. And that includes the air you breathe, the water you drink, the home you live in, the violence in your community, your access to healthy foods, your access to a pharmacist, your access to healthcare education. All those things affect that. If you don't have internet, can't get internet, can't afford internet, you're missing a big piece of healthcare information and delivery. So
Yeah,
all of these things are a component, not just one. So we have to be very careful how we make our investments. If we invest all of it in a super medication, we may miss the opportunity to improve many of the other aspects of healthcare. So I think it's a question of how you diversify your portfolio in terms of how you invest in wellness care, not healthcare,
yeah,
wellness care.
right. The
Outstanding.
fact of the matter is that by the time that a person gets a pill, that means that there's already been a failure.
Yeah.
We don't put people who haven't failed on medicine. We put them because there has been a failure in their healthy process. And so now we're trying to kind of restore it and manage it and keep the problem at bay, as opposed to we need to intervene before. We need to have ways to make certain that caring for health is a daily process.
Yeah.
It is a daily process because we feed ourselves daily. We drink or don't drink water on a daily basis, on an hourly basis. And so when we neglect to feed those things that need to be fed and provide those things that our bodies need, then we're affecting our health over the long haul. So we really have to look at it in terms of what can we do to avoid failure in one's health. And I think that's that really has to be the approach. Sure, there are going to be times when maybe not due to anybody's fault that we're going to find that somebody has failed and they need intervention and they need management. But on as we look at the mass of the population, we need to be looking at what can we do to prevent failure, and that means helping folks to understand what it is that they can do, what they should be doing, that is going to help to maintain their health. Like I said, when we look at the auto industry, now I understand that there's money to be made in doing this, but they have a process that let's do some maintenance, and theoretically it's an excellent process. We get a car, we evaluate it every so many miles, and we refuel it, we change the fluids, we do those things to help to keep it going. Now they're making money doing that. Why not put that kind of situation or that kind of investment in the healthcare system, that there is a way to for people to make money, not just on sick people, but keeping people well and keeping people from getting sick. That would be the thing that I would love to see, is that we emphasize and highlight and invest in that kind of process.
Yeah,
Can
I'm
we
going to.
do this?
Yeah,
No, go ahead.
I'm just going to push back a little bit and provide a different scenario. If you buy a brand new car and you put cheap gas in it, never change the oil, don't pay attention to the tires, you shouldn't expect that car is going to last through not through the warranty period. I mean, there's certain things you need to do to maintain the car, that as an individual you need to maintain your body. What I wanted to do, and my good friend Dr. Mason, although he's sort of retired from medicine, he still is doing things to keep people healthy, and he is a farmer now. And maybe he could talk about what food really is from the standpoint of being a farmer. And I think he's got this thing called God's Pharmacy. And maybe you could speak a little bit, because I think that we also want to be solution based. And maybe there's some other information could be provided about things people can do to be healthy.
So, Dr. Mason, as you answered that question, Miss Deborah of Coleman's Barbecue is here, and she says, "Good evening." But President Steele, that's Carrie Steele, that is, she posed the question. If you can answer when you begin to speak, she says, "Well, what is preventive medicine, and what are we doing with that?"
Well, preventive medicine to me is sort of a misnomer. It really is. I mean, because if you're taking medicine, that means you already got something that needs to be attended to. So that hasn't prevented anything. The only real preventive medicine is food. Is eating good food. That's the only real preventive medicine. Because otherwise, you're just making another category for the pharmaceutical industry. But what I will say, and I think that I've enjoyed this conversation that we're having, and to Joe's point, yes, the reason that we just decided to do work in the farm, and we've actually started again now with God's Pharmacy, and because that is the only real pharmacy. When you look at and go to the School of Pharmacology at the University of Illinois and look up a book that it talks about pharmacognosy. Pharmacognosy is the science of taking active ingredients from plants and using for medicinal purposes. So plants play a role in many, many, many ways. And I would say that we were healthier when we had less stuff. We were healthier when people had pots of greens and pots of beans and rice and other kinds of things. And if you look at, I have a presentation where a man went and took a picture of a week's worth of food from different people all over the world. And it is amazing when you get to America, the week's worth of food is mostly processed food. It's much of it highly processed food, as opposed to places like India, Indonesia, and some other places where you see predominantly vegetables and fruits and rices and other sorts of grains. So, there's and we're not taught that. Many of us, I grew up, and I knew Congressman probably grew up, and he can probably talk about this. But they didn't. We didn't have all that stuff that people have today. We grew up eating real food. We had to go and get the real greens and the real string beans and the real powder peas and the real black eyed peas and the real all of those things, and that's what we ate, and that was what sustained us. And those are the things that help us deal with one of the major problems we have in America. We spend tens of millions of dollars a year on constipation. Constipation is a foodborne disease. If you're not getting enough fiber and water, you will be constipated. And what that means is that there's not enough bulk and not enough of plasticity in your stool for it to move through easily, because it's hardened by the fact that there's not enough water in it. And that's because you're not drinking enough water, and you're not drinking enough foods that help keep the water in your system. And those things are things that contain fiber. And there's no fiber if it walks, hops, crawls, swims, got eyes of mom and a daddy. Ain't no fiber in that. So you only get fiber out of plants. And unfortunately, with our compressed time schedules and things of that nature, sometimes cooking becomes an issue. Now, the last thing I want to leave with is that I was so enlightened to hear the president talk about getting rid of all the lead in pipes and getting lead out of our water supply. That's critical. It's absolutely critical. And there's probably some other things that need to be handled in that way that have to do with other wastes and things of that nature. But the other thing is, we can't put all of this blame on the people. There's systems that are in place that help promote us not doing the right thing, that make it, and systems that help subsidize the foods that are not good for us. And even things like milk, which are things that I'm a totally milk advocate with respect to milk coming from the mother of the person or the thing that the milk is for. I'm not an advocate for milk for cross species. We need to do more to get our children a better start by feeding them the milk from their mom, because that is the absolute best milk for them, as long as the mom has no reason not to do that. But there's a lot, and I could go on because I get excited about this. And that's why I decided that we would go ahead and start doing farming, because unless you raise your food, you don't know what you're eating. You don't know where it comes from. You don't know what you're eating. And all we need is to grow the food. And there are many people that are doing it. And I've decided to join that group with others that feel the same way, so that we can go back to eating the things that were very familiar, like the congressman probably knows better than I do. Things like okra and all the other stuff that we even eat anymore.
Don't mention it. As a matter of fact, I had dinner at Robinson Ribs yesterday. And the first thing I saw when I went by the food stand, well, there were a few little pieces of okra. And, and my wife said, I guess that's why you wanted to come to Robinson. He didn't have much, but he had a little bit and some black eyed peas and so forth. But I guess the other point to me becomes, how do we convince people to make use of this knowledge that we have? I'm saying, are there places where individuals can get this information, in terms of, are we teaching it to parents who could then teach it to their children, and their children teach it to their children? It seems to me that inherently those are some of the best ways of passing on information. And if we establish places, I maintain that if you don't keep pushing it or keep practicing it, lots of times people want to discuss the differences between different races and what different races are doing. And I will often say there is not the focus on blackness in Chicago as one place that I know more about than I do any other place. That there's just not the focus on blackness as a concept and as a pride. That there used to be the Black Liberation, African Liberation Day events. All of our institutions used to promote and push the concept of Black nationalism. And it seems to me that as we began to make progress in many ways, we kind of threw out the baby along with the bathwater and we got rid of the basis that promoted much of what became the progress that we were able to make. And now lots of people don't really want to talk about Black heritage or Blackness. They want to get away from that because they've kind of lost it and lost. It reminds me of the song the Righteous Brothers used to sing. Say, you never close your eyes anymore when I kiss your lips. So no tenderness do I feel in your fingertips. Says, baby, baby, you're trying not to show it, but you lost that loving feeling, and now it's gone, gone, gone. And I think that heritage teaching has a great deal to do. For example, when we have a tradition that we paint the Chicago River green for St. Patrick's Day, I'm not seeing as many Black oriented events or even the remnants of what used to be Black songs or people at church. They don't sing the old Dr. Watts songs. They found some other kind of songs that lighten things up a little bit. Whereas the old Dr. Watts hymns kind of set a pace at church. I don't hear many of those. And I go to a lot of different churches. So I think we've lost some of that loving feeling. And now it's gone, gone, gone. And we need to find ways to try and bring it back.
Well, we are on this life on this super highway now, in the sense that everybody's in a hurry to get somewhere. And when you really look around, you just wonder, where is everybody actually going? And it seemed like at the end of the day that they aren't really going that far, that they need to be in that big a rush, because the rush is creating log jams and all other kinds of problems, that if we just slow down a little bit, I think, and sort of enjoy this moment in life. Life, sometimes it takes a long time to really learn the real values in life, and sometimes by the time you learn it, you probably are older, so old that you really don't, you can't really apply the stuff that you learn to what the trend is of the day. And so the youth movement and it's not really, I wouldn't call it a youth movement. It's just the time that we live in speaks that we have to be in a hurry. You know, I was at a fast food restaurant, and they said, "Well, it's going to take 5 minutes for the fries." They couldn't wait. They they couldn't wait for the 5 minutes to get the fries. They just said, "Okay, I'll go someplace else." You know what I'm saying is that we seem to be in such a big hurry in life that we're not really enjoying. People don't seem to, and that's what I think that's part of what takes away the joy and creates the confusion is that people are rushing and we don't have time to appreciate ourselves. We don't have time to appreciate each other, and because we're in a hurry to go someplace, if somebody steps in your way, it's a problem instead of being, just a way you can sort of okay, I mean, I'm sorry, it creates a conflict, and so. We it seemed like we're at a time. Some of the questions that are being raised is it seemed like we have a the technology to be able to educate better, to reach people better, a lot easier. And instead of getting that information and having it out there effectively doing the job that we need to have it do in terms of helping people to make the best decision for their health, we are in a hurry to sell them some stuff that is going to do just the opposite. Because again, maybe it says if you can chase the dollar, if you trace the dollar, you can find the problem. And it seems that we are in a hurry, and maybe that hurry is because we're trying to make money. We're trying to get some fame and fortune. I don't know what it is. It's just that we're in such a big hurry that we don't seem to have to take the time to really live life. And even life is very precious, and it does take time to learn that. But I just hope that we somehow can um, get that point because in addition to the food that we eat, getting the proper rest, having the proper relationship. Those are things that help to eliminate some of the stress that we have in our life. And when we do just the opposite, it creates more stress, which makes life a lot more difficult and create more problems that we have to try to solve.
I feel
Yeah,
the same way because a lot of times I will go someplace and I'll be someplace, and a person say, "We want you to say something, but you got 1 minute." And I feel like I say, "Well, yeah, I'm glad to be here. Thank you very much. Have a good evening and enjoy life, whatever." Quite frankly, that happens a lot.
yeah. I want to offer up some context of what's being said because it occurred to me that we're all from a different generation. And most of the people that are listening to this program are from a different generation than the current generation. And so I think we need to keep that in mind in terms of context. And I did take a quick look at what they call the six generations, the silent generation. Those are people born between 1928 and 1945. Then there was my generation, the baby boomers, born 1946 to 1964. Following them was Generation X, 1965 to 1980. And following them were the millennials, 1981 to 1996. And now we're talking about Generation Z, 1997 and onward. And so there's been generations of what we're talking about. And it really might be something that people have not thought about, particularly those of us that are baby boomers, that subsequent generations don't see or view the world the way we do. There's also the fact we lived in a very fast paced, high tech, disconnected world that we didn't grow up in. I can remember growing up watching my family listen to radio because nobody had televisions. I remember when all phones had cords. There are generations that have no idea of a phone with a cord, may not even know how to use a phone like that. I remember party lines, and some of you remember party lines. There's no knowledge of things like that. They've grown up in a different world. And some of the world that we've talked about is a world they've grown up in. And so how do you change that? You can't put something back in the box that's taking generations to occur. But we can help people understand the context out of which this grew. And we can talk about what people should be doing moving forward. And hopefully we can reach some of these younger people and get them to embrace some of what we're saying. They can change the world in a way that we can.
But
We're
Joe,
not
that
influencers. I know I'm not personally an influencer.
no, but I'm going to ask: is that going to make the world a better place or a more desirable place in which to live when the predictions are that many children will not have the quality of life that we have, that many children growing up right now will not experience the same quality of life that we enjoy. And yet we have always been a forward moving world where each generation is expected to be better off than the generation before. I mean that the predictions are that many of the children growing up today will not have a better or higher quality of life than their parents and grandparents. That's kind of frightening to me.
Well, you know, Congressman, I think the one thing that's different is that what, and I think Joe alluded to it, what we consider family and what a family does today, and you alluded to it, is different than what it used to be. Families, to the point, I know most of y'all are old enough to be sitting around this table, know that nobody just walked in and sat down and had a plate and just, watched TV and ignored everybody else. When it was the meal time, that was the time that we got together and we all ate at the same time and we all ate pretty much the same food at the same time. That doesn't happen as much, I don't think, these days, because everybody now gets their food. They go to whatever room, they watch TV wherever they want to watch it, or their phones, or they're listening or doing whatever they're doing. And so that family unit, and that's that is the critical piece here, that family unit is is not as intact in my mind as it once used to be, and I don't know whether or not it ever will be again. But it was that time that a lot of things took place and discussed at the dinner table, and people just didn't run in and just have something and then run back out again. So I think, to Joe's point, some of that is, that was not progress to me. That wasn't. That was the beginning of regress. And there's a lot of things that people think are progress and are better. It's not as better. It's just doing what we do at this time. And I'll stop because I know Dr. Maya and others, before we have to go, may have something else to say. But we've got to look at how we want to live. And to your point, Congressman, I grew up in a time when we had seven black banks in Chicago, that we had most everything we had. Now that's gone. And I could talk to you about what's happening in the medicine and the healthcare field. Our children may not see or be able to train with somebody that looks like them. And that's another topic for another conversation.
But it's real. It's reality. I mean, if we're not able to convince students, let me tell you, we have something in higher ed called PBIs, and we've had trouble maintaining Chicago State and Malcolm X as PBIs because there are other population groups that are constituting a larger part of the student body
Mm-hmm.
at these schools. And what the law says to be a PBI, you got to have 40% black enrollment and 40% low income enrollment. And we're not, I mean, recruitment of African American students in colleges and universities um, is not what we might think it is in terms of individuals going. I mean, you would hope that they'd be bursting at the seams. And if not in those places, some other places where skills training is being provided so that individuals can have that quality of life that we hope will occur. So I just think that we have some major work to do, beginning at the beginning, to try and make sure that young people, especially, take advantage of things that are available so that they can experience this quality of life that we hope people will have.
Wow. Well, Val Talley is here. That's the former chief of Maywood. He is here and he says, good evening to all. Need good fresh food. Donald Brayboy is here and he says, good evening. Also, Nelson, Rosalinda Nelson says, good evening to everyone. Hello, Dr. Miller. Judge Marianne Jackson says, good evening. Sorry I tuned in so late. Wanted to say I took the test and I am immune to the measles. Well, very good. Very good. Also, Donald Brayboy says, very, very frightening. Well, I know you guys hate when I say this, but it's our time. We have neared our hour and it is our time. And as always, we're going to go around the panel and we're going to ask your until next Monday. Now, I am getting a number of your questions about measles and RSV, and we're going to have some conversation about those. Don't think that we have forgotten. But we want to go around really quickly and say until next Mondays. Well, Joe, we're going to start with you. Until next Monday.
Well, I'm going to pick up on something that Reverend Jesse Lewis Jackson said years ago. Nobody's going to save us from us but us.
All right. The us saving. Absolutely. Dr. Mason, until next Monday.
Everything starts at home, whether it be functional or dysfunctional, but it starts in the home. And if we want stronger families, and if we want a stronger community, we got to have stronger families. And we've got to begin to think and act and move like a family. And those next extensions of us working together to populate our educational institutions will be a lot easier to do if we do that. But that's a challenge.
Outstanding. Well, Joe Harrington says the us, and Dr. Mason says starting at home. Well, Dr. Graham, you're until next Monday.
What all I can say is if you watch television and you see the ads, you got to be careful because they're out there trying to tell you to do something within their best interest. If they have the meats, that's not necessarily the things you should be eating. If they're promoting sweet, salty, crunchy, they're talking about this great big chunk of food for $5. Ask yourself, is that better for them or better for me?
All right, Dr. Graham. Well, Dr. Graham says to be safe. Joe Harrington told us to the us saving, and Dr. Mason says it starts at home. Well, Dr. Miller.
Well, I'm going to say that we're going to have to begin to look at the situation and then look at ourselves and say, what can I do? Because again, we got to stop looking outside for the answer and start looking from within. Because, as has been said already, is that if we don't do it, it will not get done. So we really got to begin to look within and say, look within our individual selves and see what we can contribute to the solution, because otherwise the problem doesn't get solved.
Outstanding. Well, Dr. Maya Green had to jump off and see a patient, but she texted in and she says she just wanted you guys to know social determinants of health, social determinants of health. We must remove the plague of social determinants of health. And of course, Joe Harrington said the us saving. Dr. Mason says it starts at home. Doug says we must be safe. And of course, Dr. Miller says, what can I? And I is the key word. What can I do? Well, Congressman Davis, take us home.
And Cook County Commissioner Dennis Deere says that insanity is doing the same thing over and over and expecting a different result. And, as I listen to Joe talk about these different groupings of people, and I hear so much about what millennials do and don't do and will do and won't do. And I think about we just finished an election and we had the lowest turnout in the Black community that we've ever had in a long time. And the poor fellow was running for state's attorney, who, if just a few more people had voted and voted for him, he'd be the state's attorney right now. And as soon as next year starts and we get a new administration, I guarantee you we'll be weeping, wailing, talking about how bad it is and how the state's attorney is not prosecuting the cases the way they ought to be prosecuted. And just a few more people voted. Didn't have to be many. Didn't have to be many at all.
Just a few.
2 or 3 in a precinct. And we'd have a different state's attorney. And all I can say is keep on trucking, keep on trying, keep on pushing, keep on learning, keep on acting. And I sure hope we don't have the kind of turnout in November that we had in March. Because I tell you, if we do, Lord have mercy on Chicago, Cook County, and the United States of America. So let's work to November to try and make sure that does not happen. So that's what I'm going to do. I'm going to spend as much time as I can between now and November, not only in Illinois, but in other places, trying to help make sure or try to make sure that does not happen. Thanks for a wonderful evening. Have a good day. And until next Monday, see you then.
God bless.